Hello guys, welcome back to Medico Days. So in this video, we'll be discussing few of the PYQs of ophthalmology, mainly the 2018 and 2019 years, which I had missed out previously. And so guys, quickly moving on to the details of this video. But before into that, I am happy to announce to you all that our Neetpg compilation book of 2018 to 2024 PYQs is completely ready, and if you guys are interested, you can buy it at a very nominal price, and we're also giving discounts. So guys, if you want the sample PDF, then you can contact me in Telegram. Otherwise, you can buy the book directly from the link provided in the description also. It's provided at very nominal price, and you can just it's provided in a PDF format so that you can have a quick glance through of all this. And if you are not interested to buy the book, then you can learn from the PYQs which I'm uploading in my YouTube channel. All of the questions are being uploaded here in the YouTube video also. So now moving on to the questions. Which of the following would be prescribed for simple myopic astigmatism? Answer: -1 DC into 180 degree. So simple myopic astigmatism occurs when one principal meridian focuses on the retina and the other in front of the retina. The prescription requires only a cylindrical correction to adjust the myopic meridian. So option B provides the correct cylindrical power at the appropriate axis without a spherical component, aligning with the SMA criteria. Next question: what is the causative organism of angular conjunctivitis? Answer is Moraxilla lacunata. This is a direct question. Please learn the answer directly. Yeah, that's it. So this gram-negative diplobacillus secretes proteolytic enzymes leading to maceration and fissuring. Other options like Haemophilus influenza, adenovirus, Coxsackie, they are not related to angular conjunctivitis. What is the most common cause of ophthalmia neonatorum in developed countries? Answer is chlamydia. So the serotypes D to K is the most common cause of ophthalmia neonatorum in developed countries. Gonorrhea has declined due to the prophylaxis, and chemical conjunctivitis is transient, and Staph aureus infection is less common. So the other three options are excluded and chlamydia becomes the answer. What is the cause of acute hemorrhagic conjunctivitis? Again, a direct question. So here the answer is enterovirus 70, and acute hemorrhagic conjunctivitis is also known as Apollo conjunctivitis. It presents with subconjunctival hemorrhages, chemosis, and lead edema. So enterovirus 71 is something very different. So please don't get confused between enterovirus 70 and 71. 71 causes the hand-foot mouth disease and encephalitis, and there won't be any ocular manifestations in enterovirus 71 infection. Next, Hunter-T glaucoma is seen in which of the following conditions? Again, a very direct question and a very easy question. This kind of question you shouldn't make it wrong. So here the answer is central retinal vein occlusion. Hunter-T glaucoma refers to the neovascular glaucoma occurring almost around 3 months after ischemic central retinal vein occlusion. So CRVO causes retinal ischemia leading to iris neovascularization and secondary glaucoma. Next, yoke muscles of the right lateral rectus in dextroversion is left medial rectus. So in dextroversion, both the eyes will be moving towards the right. Levoversion, it will be to the left. So in dextroversion, as both the eyes are moving towards the right lateral rectus will be in abduction, and the left medial rectus in adduction. They both act as the yoke muscles. So yoke muscles are contralateral synergists coordinating version movements. Next question: a patient 36 hours after cataract surgery presents with pain and visual disturbance. What is the management? Answer is intravitreal antibiotics. So acute bacterial endophthalmitis post-cataract surgery requires intravitreal antibiotics like vancomycin and ceftazidime as the first-line treatment. Systemic antibiotics have limited efficacy, and steroids are adjunctive, not the primary therapy here. Next, what is the most common feature of third nerve palsy in long-standing uncontrolled diabetes? Answer is ptosis. So diabetic third nerve palsy spares the pupil because of the central ischemic damage, sparing the superficial fibers, but causes ptosis from the levator palpebrae involvement. Pupillary dysfunction is seen in compressive lesions like the aneurysms. Next, what is the most common site of an orbital blowout fracture? Answer is floor. So the orbital floor is the thinnest wall, making it the most common site for blowout fracture. Example from trauma. And medial wall is the second most common. Lateral and roof fractures are rare. Next, road spots are seen in. Answer is acute leukemia. It is the one most appropriate from the answers options provided here. And road spots are also seen in leukemia, subacute bacterial endocarditis, and diabetes. So they are retinal hemorrhages with white centers. Please look upon an image of a road spot also, because sometimes that can come up as a question, a potential question later on. So just see the image of a road spot. And oval melanoma and lymphoma, they do not cause road spots. Next, a male patient with a history of unprotected sexual sexual intercourse 20 years ago presents with neurological symptoms and visual disturbances, what is the expected pupillary response to light? Answer is pupils accommodate but they do not react. So this is a case of Argyll-Robertson pupil, and they classically it is associated with neurosyphilis, and it is characterized by accommodation intact, that is the pupil will adjust to the near objects but there will be absent light reflex, so no reaction to light. Next, a 50-year-old man is presbyopic. The power of his prescription glasses should be, answer is +2 diopter. So presbyopia correction is age dependent. For a 50-year-old emmetropic patient, +2 diopter is the standard. A rough prescription of the presbyope glasses can be made by the age of the patient in an emmetrope as follows. So 40 to 44 years it will be +1 diopter, 45 to 49 years it will be +1.5 diopter, and 50 to 54 years it will be +2 diopter, and 55 to 60 years it will be +2.5 diopters. Now moving on to 2019 PYQs. Which of the following would be prescribed for simple myopic astigmatism? This is a direct repeat of the previous year question, and here the answer is -1 dC into 180 degrees Celsius. Just the exact same question had repeated as such. Next, treatment of ptosis caused by Horner's syndrome is, answer, fascinella servate operation. So fascinella servate procedure is indicated for mild ptosis 1.5 to 2 mm with retained levator function as seen in Horner's syndrome. So levator resection and frontalis sling, they are used for larger ptosis or cases with poor levator function. Next, not true about retinitis pigmentosa is, answer, ERG normal. That is wrong because ERG is abnormal in retinitis pigmentosa, showing reduced or extinguished responses. Retinitis pigmentosa classically presents with bone spicule pigmentation, arteriolar attenuation, and waxy disc pallor. Next, a 45-year-old patient with antibodies against nicotinic acetylcholine receptors presents with progressive weakness. Most common ocular finding is, answer, ptosis. So this describes a case of myasthenia gravis where ptosis is the most common ocular manifestation because of the fatigable weakness of the levator palpebrae, and diplopia may occur but it is less frequent when compared to ptosis. Next, a trauma patient presents with diplopia, epistaxis, and restricted eye movements. CT shows hanging drop sign. Diagnosis is blowout fracture. So blowout fractures of the orbital floor or medial wall are characterized by diplopia, restricted eye movements, and the hanging drop sign. Herniation of the orbital contents into the maxillary sinus causes the hanging drop sign, and epistaxis may occur because of the mucosal injury. So this is an image of the Lee-40 fractures. All of these fractures are very, very important. Please learn upon them. Next, what is the likely diagnosis from an image showing subconjunctival fibrovascular tissue encroaching the cornea? Answer is pterygium. It is a UVB induced fibrovascular growth from the conjunctiva onto the cornea, and features include the Stoker's line, that is the iron deposition, and the fucus islets and astigmatism. Pincicula is it lacks the corneal involvement. Next question, which statement is false regarding accommodative esotropia? Answer is associated with high myopia. So accommodative esotropia is linked to hypermetropia and not with myopia. So in hypermetropia, from +4 to +7 diopter, and it arises from excessive accommodative convergence. Refractive types are fully corrected with glasses. Next, which regimen is used for retinoblastoma? Again, a direct question. Answer is vincristine, carboplatin, and etoposide. This is a standard 3-drug regimen for retinoblastoma, and this combination maximizes the efficacy while minimizing the toxicity. Next, identify the test described. So this is an image-based question, and the answer here is cover-uncover test. It detects the latent squint, that is heterophoria. So when one eye is covered, it deviates, and upon uncovering, the corrective movement confirms the type of phoria, whether it is esophoria or exophoria. And the Maddox rod test assesses phorias using red light dissociation. So that is not the case here. This is a cover-uncover test. Next, a 50-year-old male presented with progressive blurred vision, photophobia, and eye pain. On examination, there was conjunctival redness, a mid-dilated pupil, and a shallow anterior chamber in the right eye. He has been treated both medically and surgically for the condition, but showed no improvement. The following procedure incorporates a device to aid drainage. Identify the device. Answer is express implant. So the clinical picture points to a diagnosis of glaucoma, which is not responsive to medical treatment and trabeculectomy, and the device used is express glaucoma implant, that is a mini shunt. It is a minimally invasive glaucoma surgery to increase the aqueous drainage. Next, identify the test primarily used to detect heterophoria by dissociating the eyes with a red lens. Answer is Maddox rod test. So it employs a red cylindrical lens to dissociate the binocular vision. The patient views a white light which appears as a red line to one eye and white spot on the other. And misalignment, heterophoria, or cyclodeviation is detected based on the perceived position of the line relative to the spot. Please look upon the image of Maddox road test also. That is also very important. Sometimes that can come up as a question next time. So that's it, guys. Ophthalmology, other years I've discussed previously, and with this video, all of the Neetpg PYQs of 2018 to 2024 year is being discussed, and we'll be coming up with a new series soon. And if you guys have any suggestions for a new series or any other new videos to be uploaded, please do mention it in the comment box. So till I come back with my new video, stay tuned. And also, since our book is ready with all the PYQs in very small, in a gist, and you with a small explanation also. So if you guys are interested, you can contact me for the book. And that's it, guys. So hope you're all doing well and prepare well for Neetpg. And if you're preparing for INICET or FMG, all the best for that as well. Prepare for that. And that's it. So bye bye, guys.